Breathing is something we often take for granted. It's an automatic process, so natural and effortless that we rarely stop to think about it. Yet, each breath is a testament to the intricate workings of our respiratory system. This system is a marvel of biological engineering, designed to sustain life with every inhale and exhale. This system, a complex network of organs and tissues, is responsible for the vital process of gas exchange. It includes the nose, throat, windpipe, and lungs, all working in harmony. It provides the oxygen our bodies need to function and removes carbon dioxide, a waste product of metabolism. This exchange happens in the alveoli, tiny air sacs in the lungs. Without this constant supply of oxygen, our cells would quickly cease to function, leading to serious consequences. Oxygen is crucial for cellular respiration, the process that generates energy for our bodies. The respiratory system plays a critical role in maintaining the delicate balance within our bodies, ensuring that we have the energy to live, move, and thrive. Activities like running, yoga, and meditation highlight the importance of controlled breathing. Understanding this system, from its intricate structure to its vital functions, is essential for maintaining our overall health and well-being. Knowledge about how our lungs work can help us make better health choices. In this exploration of the respiratory system, we will delve into its inner workings, common disorders that can arise, and the importance of maintaining its health. From asthma to bronchitis, understanding these conditions can lead to better prevention and treatment.
The journey of each breath begins in the upper respiratory tract. This is the starting point of a complex and vital process that sustains life. This is where air from the outside world is first introduced to our bodies. Every breath we take brings in oxygen, which is essential for our cells to produce energy. The nose acts as the initial gateway, drawing in air through the nostrils. The structure of the nose is designed to optimize the intake of air, making it an efficient entry point. Inside the nasal cavity, air is filtered, warmed, and moistened, preparing it for its descent into the lower airways. Tiny hairs and mucus trap dust and other particles, ensuring cleaner air reaches our lungs. The pharynx, commonly known as the throat, serves as a passageway for both air and food. It plays a dual role, guiding air to the lungs and food to the esophagus. It connects the nasal cavity to the larynx, the structure responsible for our voice. The larynx is not only crucial for breathing, but also for phonation, the production of sound. The larynx, often referred to as the voice box, houses the vocal cords, which vibrate to produce sound. These vibrations are modulated by the vocal cords to create the wide range of sounds we use for speech. This upper portion of the respiratory system plays a crucial role in conditioning the air we breathe, ensuring that it is clean, warm, and humidified before it reaches the delicate tissues of the lungs. This conditioning process is vital for maintaining the health and function of our respiratory system, protecting it from potential damage caused by cold, dry, or polluted air.
As air travels down from the upper airways, it enters the lower respiratory tract, a complex network of tubes and sacs responsible for the exchange of oxygen and carbon dioxide. The trachea, commonly known as the windpipe, acts as the main conduit, carrying air towards the lungs. Branching off from the trachea are two primary bronchi, one for each lung. These bronchi further divide into smaller and smaller tubes, called bronchioles, forming a tree-like structure within the lungs. At the end of these bronchioles are tiny air sacs called alveoli, where the crucial exchange of gases takes place. The alveoli are surrounded by a network of tiny blood vessels, allowing for the efficient transfer of oxygen into the bloodstream and the removal of carbon dioxide from the body.
Breathing is a rhythmic process, a constant cycle of inhalation and exhalation that ensures our bodies are continuously supplied with oxygen. This process is primarily driven by the diaphragm, a dome-shaped muscle located below the lungs. During inhalation, the diaphragm contracts and flattens, creating more space within the chest cavity. This expansion lowers the air pressure inside the lungs, causing air to rush in from the outside. Exhalation, on the other hand, is usually a passive process. The diaphragm relaxes and returns to its dome shape, while the muscles between the ribs also relax. This decreases the space within the chest cavity, raising the air pressure inside the lungs and forcing air out.
Section 5. Gas exchange, the heart of respiration. The primary function of the respiratory system is gas exchange, a vital process that sustains life by ensuring that our cells receive the oxygen they need to function properly. This process involves the inhalation of oxygen-rich air and the exhalation of carbon dioxide, a waste product of cellular metabolism. The exchange of gases occurs within the alveoli, which are tiny balloon-like structures located at the end of the bronchial tubes in the lungs. These alveoli are surrounded by a network of capillaries, which are small blood vessels that facilitate the transfer of gases. When we inhale, oxygen from the air diffuses across the thin walls of the alveoli and enters the surrounding capillaries, where it binds to hemoglobin in the red blood cells. These capillaries are part of the pulmonary circulation, which is responsible for transporting oxygenated blood from the lungs to the heart. Once the oxygen-rich blood reaches the heart, it is pumped through the arteries to various tissues and organs throughout the body. This ensures that every cell receives the oxygen it needs to produce energy and perform its functions. Meanwhile, carbon dioxide, which is produced as a byproduct of cellular metabolism, diffuses from the cells into the blood. This carbon dioxide is carried by the blood back to the lungs, where it is expelled from the body during exhalation. The removal of carbon dioxide is just as crucial as the intake of oxygen, as an excess of carbon dioxide can lead to harmful effects on the body. The continuous exchange of gases in the alveoli ensures that our blood remains oxygenated and free of excess carbon dioxide. This delicate balance is maintained through the rhythmic process of breathing, which involves the coordinated effort of the respiratory muscles, including the diaphragm and intercostal muscles. This continuous cycle of gas exchange ensures that our bodies have a constant supply of oxygen, which is essential for cellular respiration and energy production, and that carbon dioxide is effectively removed, maintaining the delicate balance necessary for our survival and overall health.
Section 6. When breathing falters. Common respiratory disorders. The respiratory system, while remarkably efficient, is vulnerable to a range of disorders that can disrupt its normal function. These disorders can range in severity from mild, temporary illnesses to chronic, life-threatening conditions. Among the most common respiratory disorders are infections, such as the common cold, influenza, and pneumonia. These infections can cause inflammation and fluid buildup in the airways, making breathing difficult. Obstructive lung diseases, such as asthma and chronic obstructive pulmonary disease, COPD, are characterized by airflow limitation, making it difficult to fully exhale. Restrictive lung diseases such as pulmonary fibrosis limit lung expansion, making it hard to take a deep breath.
Section 7. The Doctor's Toolkit. Diagnosing respiratory problems. Diagnosing respiratory disorders often involves a combination of medical history, physical examination, and specialized tests. Doctors typically begin by asking about symptoms, such as cough, shortness of breath, chest pain, and wheezing. A physical exam may include listening to the lungs with a stethoscope to assess breath sounds, tapping on the chest to check for fluid buildup, and observing the patient's breathing pattern. Pulmonary function tests, or PFTs, measure lung capacity and airflow, providing valuable information about lung function. Imaging tests, such as chest X-rays and CT scans, can reveal structural abnormalities in the lungs and airways.
Section 8. Caring for the breath nursing considerations. Nurses play a vital role in caring for patients with respiratory disorders. They monitor vital signs including respiratory rate, oxygen saturation, and heart rate, watching for any signs of deterioration. Nurses administer oxygen therapy as needed, ensuring patients receive the appropriate amount of oxygen to maintain adequate blood oxygen levels. They also provide education on breathing exercises such as pursed lip breathing to improve lung function and reduce shortness of breath. In addition to providing direct patient care, nurses play a crucial role in educating patients and families about respiratory health.
Section 9. A lifetime of healthy breathing. Breathing is essential for life, and maintaining a healthy respiratory system is crucial for overall well-being. Simple lifestyle choices can make a significant difference in respiratory health. Avoiding smoking and exposure to secondhand smoke is paramount, as tobacco smoke is a major risk factor for a wide range of respiratory diseases. Regular exercise strengthens the respiratory muscles and improves lung function. Protecting oneself from respiratory infections through frequent hand washing and vaccination can also help keep the respiratory system healthy. By making conscious choices to protect our respiratory health, we can breathe easier and live healthier lives.